Some good news today for an important program at St. Vincent Charity Hospital. Our senior health correspondent, Monica Robbins, is here now with that and a lot of medical news for us tonight. Hi, Monica.
Yeah, hey, the Alcohol, Drug Addiction and Mental Health Services Board of Cuyahoga County approved $4.4 million to fund the St. Vincent Psychiatric Emergency Department. Now, that funding will get them through 2023. Now, when St. Vincent announced it was closing inpatient care, that affected the psychiatric beds as well, and there was concern the Psychiatric Emergency Department would close too. But now, it will stay open.
That'll be used for the psychiatric emergency department. It'll be used for 23-hour observation. It'll be used for psychiatric services. It'll be used for people who are in a psychiatric crisis. But what St. Vincent's has told us is that, that the continued operation of the psychiatric emergency room, that they are working on transfer agreements with other area hospitals. So if a person would need inpatient services or behavioral health services, inpatient services, hospital stay, that they could be transferred to another area hospital.
St. Vincent's Psychiatric Emergency Department cared for nearly 3,500 patients a year who needed crisis care. So this is a very, very valuable safety net resource. And there's some more positive news in Ohio, too. Ohio Guidestone just received $8 million in 2 federal grants to develop certified community behavioral health centers in both western Cuyahoga County and a 4-county region in northwest Ohio. It will provide crisis care for both adults and children 24/7. So that's good news.
Good news there, certainly. Okay, let's talk about some other things in the news. Thursday, new COVID numbers came out. We haven't been paying a lot of attention to them of late. What do we need to see today?
We haven't needed to, and we're still seeing a downward trend, which is very, very good news. Just over 8,500 cases reported in the last week. That's down about 1,400 from the week before. ICU admissions and deaths also down, but there was a slight uptick in hospitalization. Also in COVID news, university hospitals received a grant from the American Lung Association to study long-term consequences and outcomes of those who suffer from long COVID. That's research we definitely need.
You reported on this yesterday. When I get these numbers right, UH announced they're laying off 117 administrative employees and not filing some 326 positions, not filling those, rather. Do you think we're going to see more of those?
You know what? Unfortunately, yeah, I do. You know what? UH said it lost about $200 million in the first 8 months of this year. Other hospital systems, both locally and across the nation, are having the same issues. There is a caregiver shortage. Those jobs are safe, but for those who don't deal directly with patients, I would not be surprised to see more of this, nor would I be surprised to see more hospital restructuring announcements in the next few months. We're just going to have to wait and see. But yeah, this pandemic was, ravaged a lot of income relating to hospitals.
Yeah, okay. Monica Robbins, thank you.
Sure.